Good evening and welcome to the Ombudsman program. My name is Diane Wellborn. I'm the Ombudsman and I'm going to be your host for this evening's program. Tonight our topic is protecting elders from abuse. And I'm very pleased to have with me two individuals who are quite active in the protective measures at the State Attorney General's office and right here in Montgomery County to protect our elders from abuse, either physical or financial abuse. I want to remind our viewers tonight that this is a call-in program, and so the number will appear on the screen, and if you have a question, we'd like to hear that, so don't hesitate to pick up the phone and call. But now I'm going to introduce my guest, and we'll get started because we have a lot to cover tonight. I have with me Ursel McElroy, who is the Elder Justice Initiative staff person for the Ohio Attorney General's office. Welcome, and thank you very much for coming over from Columbus for the program this evening.
Absolutely, thank you, Diane.
I'm very pleased to have you.
Thank you.
And we also have with us Patrick Bailey, who is a Deputy Director of our Montgomery County Department of Job and Family Services. Thanks also to you, Patrick, for coming on this evening. As I said, between you, there's a lot of time spent in protecting elders from abuse and a lot of activity and a lot of advocacy between you. So I'm going to go ahead and just ask you to briefly start us off by telling us first, you, Ursel, please, a little bit about the Elder Justice Initiative for those who may not know that this does exist through the Attorney General's office.
Absolutely. Well, on May 6th of this year, Attorney General DeWine launched our Ohio Elder Justice Initiative. The idea behind the initiative is to enhance access to criminal justice services for victims of elder abuse. We know too often that their cases don't receive a full criminal investigation or prosecution. And so we wanted to see what we could do to bring to bear our existing resources to help out in this area. So with the initiative, we've brought together many resources from throughout our office, our Bureau of Criminal Investigation. They help with the investigative part, the intelligence, the analysis of the intelligence that we collect. We have also our consumer protection section. They are involved with the frauds and scams that we often hear about. In addition to that, we have our healthcare fraud section. They investigate any concerns of patient abuse and neglect within the nursing facilities. We've also brought to the team our crime victim services section to provide victim advocacy and service coordination, because oftentimes many of the victims of elder abuse are not linked with those victim advocacy services. And so we want to put a change to that. We want to bring change to that and make sure that they are connected. In addition, we have our special prosecution section, and they help with the case presentation, the case preparation, if and when a local prosecutor asks for our assistance. So we're really proud of the team that we've put together.
It sounds like it's quite a broad collaboration of very many services that were already going on with a new special focus on protecting elders. Wonderful initiative. Well, Patrick, tell us about the role that is played at the county level in protecting elders from abuse and exploitation.
Well, Adult Protective Services is the entity within Montgomery County Job and Family Services that is charged to go out and investigate reports of elder abuse. And so the unit of 8 workers and 1 supervisor goes out and investigates elder abuse. And elder abuse is really kind of separated into 4 main areas. You've got your typical abuse cases, which most people think of physical abuse. You've got self-neglect cases where an individual is not taking care of themselves, or there's an allegement that they're not taking care of themselves. There's also neglect by a caregiver, where a caregiver who is supposed to be taking care of the senior is not doing that. And then there's exploitation cases. And so APS is very involved in all the reports that come in. We work really hard to try to make sure that when we do go out in the field, that we make sure that the seniors that we touch base with know that we're there to help them and protect them. We're not there to, some people have this misconception that we're there to put them in nursing homes. That's not our role at all. We don't even have that authority. what we're there to do is just to try to make sure that they're safe and that they've got services and supports to help them continue to live in their home as long as they can, and also to give them information that they might not be aware of, services or supports or things in the community that can really help them stay and live a healthy, viable, life, in their home or wherever they choose to live.
Well, thanks to you both for getting us started on that. We're going to come back with more details about the intricacies of the work there. Let's talk a little bit, though, about how our demographics in Ohio and in Montgomery County are changing with respect to the increase in our elder population. What's happening to us? How are we aging here? I'll start with you, Patrick.
Well, in Montgomery County, we are aging, and what you see is that the baby boomers are now hitting 60, and so there's more seniors than what there's ever been, and that trend is going to continue. The other thing that you see is that individuals are living longer. So now we've got more people hitting 60 than ever, and people are living longer. And so, with that combination, what we're seeing is that we've got more seniors to serve. In 2000, we had about 17% of our population was 60 plus. In 2010, the census showed that that is now about 21%. So we've increased by about 4% of individuals over 60. And by 2030, 15 years from now, 30% or more of Montgomery County's population will be 60.
Wow, that is a very big increase. Would you like to comment on this changing demographic as well?
Absolutely. I think what Patrick is pointing out is pretty much reflective of what we see across the state. According to some really good data that came from Miami University, their Scripps Gerontology program, by 2020 we should expect a 29% growth in the 60 over population since 2010. And then when you look at that for 2040, it's estimated that will be a 50% growth. So certainly we do have a situation where our state is aging, if you will.
Right. And of course that's going to impact both our state and county services in many more ways than what we can talk about tonight. Yes. But we at least wanted to get that changing demographics out, that protecting our elders is important now and will grow and even be more important in the future. Right. Let's come back and talk a little bit more in some more detail about adult protective services. At specifically the Montgomery County level because of your expertise, and then we can add in some things also from the state level. Are we seeing an increase in calls that are coming to our local APS, and what areas are we hearing about?
Yes, we are. In the last several years, we've seen a pretty significant increase. In 2010, we had about 752 reports of elder abuse. Last year, we had 920 reports. We think we think there's probably 3 or 4 factors that are playing, a role in those. One of the factors we think is that there's more seniors than ever. Another one of the factors is that until just recently, our economy locally was really struggling. And so we started to see a significant increase in exploitation cases, we think in part because of that. And then lastly, our CANE initiative, which I know we're going to talk about a little bit later on, but that's our collaboration against abuse, neglect, and exploitation. Our group has worked really hard to help educate community providers and the public as a whole about adult protective services. And so because of that, because more people are aware of adult protective services, because they're more aware of elder abuse, because they're more aware of the number to call about abuse, we're receiving more calls.
That's
Absolutely.
great. And what is that number? We'll come back and give it again before the end of the program, but let's toss it out now.
It's 225-4906.
Okay, great. And when a person makes that call to them and they are going to report what they suspect is a problem, what are they going to go through when they make that call?
I mean, the types of things that we really need when they make the call. Sometimes they're talked to a live person, other times they're just going to get a recording. But we need the individual's name, we need their address, we need their age, their phone number if we can. We need to know what is the type of abuse, what's being alleged, what is going on in the situation, and who is the alleged perpetrator if there is one. If it's a self-neglect case, there's not a perpetrator involved at all, but if they have a suspicion on who it might be, all that is really helpful information so that we can then go from there and follow up.
Okay, all right. And do we have a database keeping track of what we are seeing all across Ohio as far as reports into our adult protective services? Because, am I correct, is there one in every county that we have? There's APS in every county, maybe stronger in some larger counties than others, but do we have a generalized database that's giving us information, or registry?
Right. Well, the state agency that has responsibility for this is the Ohio Department of Job and Family Services, and I know that they have worked to collect some data on the different types of reports that do come in. However, through the Attorney General's Commission, one of the things that we have pushed for is to have more robust data. We want to have a good handle on every report that comes in. We want to have that information. With that information, we think we'll have good information on trends. We'll have opportunities to see where we're getting the cases from, what type of cases, how long it takes to resolve a case, how often the cases come back. And then there's also that very important issue of if we have a perpetrator that crosses county lines, we want that next investigator, that next worker to be able to have that data available so we can become involved and already be a step ahead. To have to begin from ground zero each time sort of puts us behind. And when we're working these elder abuse cases, we really don't have the luxury of time. There is a concern of loss of life, there is a concern of loss of assets, and so the more quickly we can respond, the better chance we have with our interventions.
Okay. Is there anything else we need to tell our viewers about the numbers or increases in reports, either statewide or county level?
What I would like to say, and Patrick certainly jump in, I don't know if you find this to be the same in Montgomery County, but what we're finding across the country is that the reporting is not necessarily reflective of the prevalence. In other words, for every one report we receive, we believe that there are 23 that remain hidden. That is the most recent prevalence study that was conducted in New York, the state of New York, and that is the data and that is the figures that we are utilizing now. It had been in past times, we would say for every one there was 5, but we now know it's even worse than we thought. So while we're glad that we're receiving the reports that we do, we know that there are many more individuals that have not come to the attention of the authorities.
Okay. And what would you all give as some of the background reasons for this? Why is this the strong suspicion of underreporting? Why does that exist?
Well, I'm going to do a few and then I'll pass it off to Patrick. I think we both want to hop in on here.
Right.
I mean, I think it's a combination of certain dynamics as well as some systemic issues. With the dynamics, I know with Patrick working with Montgomery County, I'll let him probably handle the majority of those, but with some of the systemic issues, I think that we have to do a better job with our outreach efforts. We have to do a good job in making sure our mandatory reporters, one, know that they're reporters, and two, know how to report once they identify there is a suspicion of abuse. So helping people identify what abuse looks like. It's not always as obvious as it seems. It can be subtle, but if we help people understand what that looks like, I think they'll be better equipped to identify, they'll feel more comfortable with reporting, and I think we will find that more reports will come in once we generate that confidence from the public that we will be responsive. So I do think that from a systemic perspective, we have to do a better job with outreach and connecting and making sure people identify and then report. And then I'll let Patrick touch on some of the dynamics.
Yeah, I mean, I would totally agree with what she said. And that's why when I pointed out earlier about our King Collaborative, that's in part reason why we believe that our numbers have gone up, is because that we've done a better job of educating the community and the providers that work with seniors, so that when they see unexplained bruises, or when it's a teller at a bank and they see something, the customer that's the normal jovial person coming in,
Right.
acting totally different and asking for large withdrawals and some things like
Right.
that people are not just being suspicious and then leaving it there, but they're picking up the phone and they're
Absolutely.
calling, because that's what makes a difference. I think the other things too, and I can't, I think sometimes there's a stigma that's attached, that if I've been, let's say for instance, if I was exploited, there's some individuals that would feel ashamed that happened to that. How could I let that happen to me? Somebody take advantage of me like that. And there's also a lot of, I think, family dynamics.
Yes.
One of the things that is most disturbing about elder abuse is that you see, 50-60% of the cases, a lot of the abusers are family members. And so, that complicates things. You now have a situation where you could have a child or niece or nephew who's the abuser, and it makes it more challenging for the person who's being abused to want to call for help, to want to implicate them for what they've done or the things that they've said to them or along those lines. So it gets kind of complicated, and it makes it, I think, challenging for the individuals that have been abused to want to take that next step because of family and love for family members and all the other things that you can possibly think of. It just makes it complicated at times.
Well, thank you for bringing that out. I think that is a very significant factor there. There's oftentimes shame involved, and then there's oftentimes pain because the perpetrator of the theft or the abuse is, as you say, a family member. It's important for people to recognize how hard that is. We talked a little bit about just making an initial phone call to APS. If a person wanted to call and make an anonymous report, is an anonymous report accepted and acted on? Okay.
It is very much accepted. Individuals, any person that makes a report, they have the option of indicating who they are and also indicating whether or not they want to remain anonymous or not. And APS, we follow their wishes to keep them anonymous. So that is not a problem or issue for someone to make an anonymous referral.
Okay, and you've already mentioned that the phone call, if they get a machine, they can leave the pertinent facts that
Right.
you just described for
Right.
us, or if they do call during the hours when there's a live person to speak to, that they will be asked to give all of those facts. Is there a way to submit a report by email at this point?
The way that typically is done is that after hours, we've got an agency in our community that fields that our phone gets routed to them, and so those calls go to them, and then they will take down that information, and they'll they'll fax that to us or email that to us every day. So we actually have coverage for APS in Montgomery County 24 hours a day, 7 days a week, 365 days a year. When it's a holiday, we've got a group of individuals that are on rotation, and so if it's your week, it's your week. It doesn't matter what day or what time of the day or night it is, and I can attest to that because I've been on it before. So I've had some calls in the middle of the night.
Yes,
Yeah,
yes.
I've had some
Okay,
calls.
so 24/7, it's answered, and an intake can happen. And then what happens after that? Why don't you just kind of walk us through?
Sure.
Is there a required amount of time for your agency to respond to a report, and how do they respond to a report?
Yeah, as the reports come in, essentially, the Adult Protective Services is going to take a look at the referral. They're going to gather all the information that they received from the caller. Many times they're going to call them back to try to get additional information. Then they're going to determine if it's a proper referral. In other words, is it age appropriate? Is the problem indicated? Is it really abuse, or is it more of a something that's not abuse related at all? Also, is it in Montgomery County or not? If it's not in Montgomery County, then we would make a referral to another county. Then once we've done all that and gathered our information, then we're going to make an unannounced visit to the home. And the reason why we do it unannounced is we don't want anybody to be prepared for our visit. We want to, catch things as they would typically be. We, go to the door. We identify ourselves with our ID or with our county ID, and our workers are really good at helping the seniors know and trying to help put them at ease that we're just there to make sure that they're safe. That's really why we're there, is just to make sure that they're safe, that everything's okay with them. Sometimes we go out and we simply do not see anything. Other times we go out and we see things that would turn your stomach. So, so when the worker typically the worker is going to go in and they're going to speak to the client for some time. They're going to ask them some questions. They're going to let them know what the allegation was. If the person wished to remain anonymous, they're not going to let them know who made it, but they're going to just let them know, what the concern was and why they're there. And they're also going to try to make them aware of things that would be helpful to them, given their situation, or things that maybe that they're observing in the home. They're going to take a look at their environment and some of the issues that the person might be going through, and trying to provide helpful advice, suggestions. But it's really it's that seniors, it's their decision, what they want to do with what Adult Protective Services brings to them. If Adult Protective Services, if the senior tells Adult Protective Services that they don't want them to return, and they don't want services, then we back away. As long as the senior is competent and we don't have an issue or a concern about them being able to make, good decisions that are safe and that they're ambivalent to what their situation is. They've got the freedom to choose.
We will come back to that important freedom to choose, but I'm being told that we have a call that would like to ask a question on the program. So thank you for calling in. We're ready to hear your question. You're on the air.
Thank you. This is such an important program you're doing tonight, and it's so terrible what happens to so many seniors. I'm calling about a kind of fraud that I've learned has been perpetrated against seniors. One of my colleagues, his elderly grandmother was defrauded of $38,000 by a scam that used popular prepaid debit cards operated by a company called MoneyPack and sold by something called the Green Dot Corporation. Is this something that your guests know about, and what can be done to protect seniors from this kind of thing? $38,000. It was a terrible loss.
Yeah, that's that.
It was almost all of this old lady's life savings.
Thank you for your call. We appreciate that question, and we will get the response from our guests. Thank you again. Which one of you would like to take take a stab at that one?
Well, from the perspective of the Attorney General's office, we have, through the initiative, one of our partners is our Consumer Protection Section. And one of the main roles of that section is to investigate, is to concern itself with any issues of frauds or scams, in particular those that affect many older adults. So what I would suggest is, if you are aware of a fraud or any type of scam, that you could certainly go to our website, www.ohioattorneygeneral.gov, or you can contact us at 1-800-252-0515. what you can do is report that information. That information is collected. That's very helpful for us because we collect a lot of intelligence and a lot of information that allows us to then determine what our next course of action is. Do we have history with this company, and what can we do? So I would say first report it if you're aware of it. Second, one of the things that we are very involved with is to try to prevent it. Prevention is key in a lot of these cases. So we're out all of the time educating people on the newest scams, on the newest frauds. They are ever changing. They change as fast as our technology does. For as many ideas as we have to stop them, they come up with new ones to try to get over on individuals. And so we are constantly making ourselves aware of these and making sure that we are educating the public on what we know so that we can prevent it. Then finally, once we know it's happened, and if there is enough evidence there, if there's enough concern there, and each thing is case specific, so I need to really emphasize that. But that being said, we can then perhaps go forward with an investigation and even a prosecution. And we've been successful with that in other circumstances where there have been different frauds and scams. So it really is very case specific, but we do have a really good protocol in place when we have when we have an Ohioan who is aware of a scam.
Okay. And in the example just brought to us by the caller, if a family member becomes aware that somebody has become a victim to this type of scam, is it best to call the number you've provided at the county? Is it best to call the Attorney General? Is it best to call both of you and let you all sort it out about who is best for this case? What's the best way for people to proceed in a situation like that?
Well, for the scams and the fraud, I guess this is my easy answer for this, and Patrick certainly jump in and let me know how you feel about this. But I think that I get concerned when we try to tell individuals how to sort it out and to whom you ought to contact, because I think that makes it somewhat difficult because we have so many ways you can report it within Ohio. I think we are a little different in that regard. Depending upon where the person is, depending upon your age, I mean, it all makes a difference where you report. What I would recommend is always start with your local authorities. That is my go-to. Start with your local authorities and let them know what's happening. I think within our office we do a really good job in trying to educate our local partners on the resources we have and how we can assist them. And so I always say start with your local authorities. If for some reason you're not sure who to contact, if for some reason after you've made contact you still have some unanswered questions, then you can always still contact us. We will certainly work with you and help you get to the right place. But I think it's always good to start with your local authorities.
Right. And in that kind of instance that the caller provided, it was, sounds pretty clear to me anyway, it's not the case of a family member, it's not the case of a neighbor or a niece or a nephew or anything like that. It's somebody reaching out to her from far away. And that is an even more, I think, challenging kind of thing.
That's why it becomes challenging, and that's why if you start, it's important to start with your local authorities for one, because I think, you know, they are your local authorities. You want to touch base with them, see what they have to offer. Two, they're aware of what we can offer, so they can make contact with us. They will know who to contact and how to reach out to us. But in addition to that, there may be other things going on. And I think it's important for your local authorities to be able to look at the whole picture. You know, oftentimes we talk about elder abuse and the different aspects of elder abuse in isolation. And we have to be really good about being certain that we get the whole picture. Generally speaking, if we learn of one type of abuse, it's not uncommon for there to be a co-occurrence. So maybe we have someone who is a victim of a fraud or scam. We perhaps want to concern ourselves with other areas of their life. Are there other things that maybe we can be involved with? Are there other things that we can be helpful with? We want to get the whole picture. And your local authorities will be there, they're present, and they can do that. If the case in the event, such as what the caller described, where you have a situation where maybe across the state lines, maybe we have to get federal authorities in place, then that perhaps is a situation where your local authorities will bump it to our office, and we have those relationships, and we'll make those connections, and we can perhaps move things in a forward-moving direction. But again, I just always will say start with your local, let them then contact us and ask for our assistance, and we're more than willing to give it. But again, if you have concerns or if you feel you have unanswered questions, you are still more than welcome to contact us directly.
Okay, thank you very much. That's helpful. Anything you want to add on that point, Patrick?
No, I would agree with what Ursel said. It's important for us to be aware of what's going on locally. Again, we can go out and we can, we're very knowledgeable, and we understand the services and things that the Attorney General's office provides, and we're going to reach out to them as appropriate. And there, like she said, there might be other issues going on that that we might need to take a look at as well. So I agree with what she said, and I think it's a good protocol to call local, and then we'll move it from there.
Okay. And with our local work and the 700 plus calls that we've had at the local APS, are the calls and the situations, does it frequently trigger law enforcement involvement? Does it, for the most part, are you finding self-neglect, or are you finding something that services can ameliorate, or are you finding in more cases crimes?
I mean, the majority of the cases that we see, about 50 to 60% are self-neglect cases, but that doesn't really nominalize all the other types of cases that we get. Abuse, neglect of a caregiver, or exploitation. What we've seen over the last 4 or 5 years is we've seen exploitation rise pretty significantly, and some probably almost twice as much as what it was about 5 years ago. So we're seeing exploitation cases very much on the rise in our local community, which is concerning. We prosecuted several individuals for situations where they've exploited a senior as well. So we do involve law enforcement. We involve law enforcement if there's a safety issue, or if there's a crime involved, obviously, or it just depends on the, it might be just an ancillary matter where we're asking them to do a safety visit. Maybe we've been out there recently, but we got another call, and we want them to take another look at it. We also have the capability at the local office to kind of look in a database, and so if there's an alleged perpetrator in the home that's got a criminal record, we can check that out before we go out. And so if there's a situation like that, we very well may contact law enforcement and bring them, and have them meet us out there. Also, law enforcement is contacting Adult Protective Services, so it's not just one way. It really goes both ways.
We have another caller,
Okay.
so we're going to come back to the involvement and the two-way stream with law enforcement. Yes, thank you for calling into the program. You're on the air.
Hi, I have a question. What does APS do when they receive a complaint?
Thank you very much. We're kind of getting into that, so we'll continue. Thank you for your call. All right, when you receive a complaint, as the caller said, we've talked about how you go and visit the home, and you make an unannounced visit,
Right.
so everything is as it normally would be. And then you might take law enforcement with you, depending upon what you know about the home or what you think it was reported and what you might find. So why don't you continue on, and then about the two-way street with law enforcement.
Sure.
And what kind of interventions you all have that you can offer to the victim. So
again, and I think I failed to mention this earlier, but when the call comes in, we're trying to determine is it a crisis type of a situation, or is it more of a situation that doesn't need to have someone out there right away? If it's a crisis situation, we're out there no later than 24 hours. If it's what we call a routine referral, it would be up to 3 days. So we would go out there, we would investigate. We always make at least 2 visits to them, to the individual, to check to see how things are going. We're trying to provide them information and referrals to things in the community that might be helpful to them. Also, if it's a situation where there's abuse and we're concerned about them and they're willing to take the appropriate measures, we can help plan for them to get out of there, or we can work with the prosecutor's office and get we can get some things done so that we can restrict the person from coming to the home, or or things along those lines. So there's a lot of things that we can do in different situations to help the individual out. It really kind of depends on what it is. If it's an exploitation matter, a lot of the questions in the probing that we're going to be doing is going to be on the lines of looking at the financial matters, and asking them for financial documentation and trying to get releases of information so that we can get as much financial information about their situation as we can, so that we can then, Adult Protective Services works closely with our county prosecutor. So we need to make sure that we can get all the information that we need so that we can move it on to the prosecutor's office so that they can take the next step, and look for prosecution if it's a possibility.
I want to interject something here to Patrick's point, though. One of the things that I want to mention about the initiative, and I'm hoping that more counties will certainly take advantage of, we've had more than half of the counties certainly reach out to us for this. But at the point when Adult Protective Services becomes involved, I think one of the things that we're hoping to see is a greater partnership between our office and them. Many times the financial records are just, quite frankly, more complicated than more complicated perhaps for the APS worker, as they would be for you or I. What we have in our office, though, are forensic accountants. And they can, along with our BCI agents, they can subpoena those bank records. And we have good relationships where we can get them in a pretty reasonable amount of time. And then we have the forensic accountants who can actually go through these very complex documents. And I mean, sometimes we get mountains of documents and then make some determinations on some things that are less than obvious to the average person as to what has happened. And so I think if we are going to do a really good job on being able to find those cases where there is exploitation, being able to have enough evidence to support our claim of exploitation, then we have to, as soon as possible, be able to get those records, review those records, and then be able to show those patterns. And so one of the things that we're trying to do is be supportive to APS. So when they're out there, they're looking at the documents. Certainly, we want you to go to your local law enforcement department, but they have a relationship with us, they being local law enforcement, that they call on us and they request our assistance. Once we get that formal request, then we can go in and assist with the investigation. We can bring our forensic accountants out, and we can move things forward. We've been successful, even most recently in September. We have an indictment in one of our Ohio counties right now on a couple who's taken an older woman for $160,000. And that was due to us being called in, being able to actually go through the documents, work with Adult Protective Services, work with law enforcement and their local prosecutors. And so we're now moving past the arraignment, and hopefully someone will perhaps get some time. That's what we're hoping for.
Well, it certainly sounds like it's headed that way. And I have to ask on those types of cases, our earlier caller and then some of the exploitation cases that you all have been involved with, is there much hope of getting the money back?
Well, in terms of restitution is what you're talking about, and recovering those funds, I have to say that obviously the more time that passes, the less likely it is we'll recover those monies, because a lot of the money is spent. It's gone. And so recovery, the opportunity to recover the money does diminish as more time passes. Again, I can't stress the need for urgency. If we are able to get reports that come in really quickly at the beginning, we can stop the bleeding, we can get in, and perhaps we can recover monies. If we talk many months after the fact, if we talk years after the fact, it becomes very difficult for recovery. Not impossible. We still work towards that, but often unlikely.
I see. Thank you. Again, following from the types of exploitation that we've been talking about here at this level, What is the expectation, or what are the responsibilities of our financial institutions who may see patterns and may even witness events? You mentioned earlier a person comes in with a very changed attitude, or very large withdrawals might be one thing, but what are the expectations from our Attorney General's office and our county about our financial institutions and their level of involvement here?
Well, I'll talk about it from our office perspective, and then I'll pass it on to Patrick. I've made reference to House Bill 49 a couple of times here this evening. House Bill 49 is known as the Ohio Elder Justice Act. It's passed the House. It's now sitting in the Senate. One of the pieces of 49 expands our mandatory reporters within Ohio. Currently, our financial institutions, our financial service providers are not mandatory reporters of elder abuse to adult protective services. So we have to get over that first hurdle, in our opinion, is to have them as mandatory reporters so that we can get that information.
I'd like to stop just a second. I'm not sure everybody generally understands what a mandatory reporter is.
Absolutely.
So maybe we want to kind of go back a little bit. And what is a mandatory reporter, and how does one know if they are one or not?
Right. A mandatory reporter within Ohio for adult protective services, there's a list of individuals by profession. And if you're listed, you have a duty, a requirement by law to report any suspected elder abuse to adult protective services. You know, the idea is that if you see it, you'll report it. Based on your profession, you have an obligation, no different than perhaps with a child abuse case. So there's a very long list of individuals, those who are probably the obvious, and then some not so obvious on the list. But one that we believe is absolutely missing, considering the growth of the financial exploitation cases, is the banking institution or the financial services industry.
Right.
There has been a lot of discussion about this, not just within Ohio, but across the country. There has been guidance issued on the federal level to banks regarding what they can and cannot report. There have been advisories issued to the banks to say that you can report these things. If you report these things, this is the mechanism by which to do it within their own reporting system. Certainly, I know within Ohio, our partners, and I say our partners, the Ohio Bankers League, the Ohio Credit Union League, the Ohio Department of Commerce, and the Community Bankers Association of Ohio have certainly come to the table with us most recently to discuss this issue and to help us plan a symposium to address this issue, which we just hosted October 28th.
No.
And so we're very excited that we will have a report that comes out at the end of this month that we will certainly publish on how we can get to that point. Because certainly there are some concerns on their end that we have to consider, because they're the older people that come in are their clients as well. And they certainly want to respect their right to privacy and how they bank and their different practices. But then we have this other issue that continues to grow, and that is if you are front line and that person standing there, if we know about it when $100 is gone, then perhaps we can prevent 100,000. And so we have to figure out what the balance is and what we can and cannot do, and so that it works well for both parties, both those of us who want those reports and those we're asking to report. And so I have to say that they've been very amenable with respect to this symposium and asking their membership to come and to attend, and now we're just waiting for the report.
Okay, very good, the report from that. All right.
Correct.
And Patrick, at the local level, this might be a good time to talk a little bit about Kane and its role with respect to the financial institutions.
Yes, CANE has been, like I said, CANE stands for Collaboration Against Abuse, Neglect, and Exploitation. And essentially what it is, it's a multidisciplinary team that's focused on elder abuse. And so a lot of what CANE has done over the last several years is to help educate the public, which includes the financial institutions in the county. We've had a lot of success with our credit unions in the county, and a member of our CANE collaborative works for one of the credit unions, and so we've had some inroads there where we've actually been able to provide training to their upper management about what elder financial exploitation looks like. And then we've also developed materials that they could give to their frontline staff so that they would also have some material to help them better understand exploitation and what it looks like, as well as the other forms of elder abuse, because you see it in all forms. And so Kane is really, we've had an opportunity to make an impact both for financial exploitation and just, for elder abuse as well. And we've seen, many partners in our community step up and make referrals, regarding financial exploitation.
That's great. If somebody wants to learn a little bit more about Kane, is there a website, or should they call you? What's
Sure.
the best way to find out a little bit more? Because some of our viewers may even want to get involved with Kane.
Yeah, one of the ways that they can find out more information about Kane is we've got a website. It's www.kanemcohio.org.
All right.
And that gives you some basic information about Kane and what we've done in the past and things that we'll be doing. One of the things we've done a couple of times in the past is we've had some symposiums or some conferences that have focused on elder abuse, and that's something that we're going to be looking at in the future as well.
Okay, well, very good. Let's talk a little bit before our time runs out here about what services are available to help people who are victims. I mean, the trauma of losing a big piece of life savings, of being mistreated by a loved one or a caregiver. What services are there to bring to bear to help people who have experienced this?
Within our office, we are the administrator of the Victims of Crime Act and the State Victims Assistance Act. And essentially, those are federal dollars and state dollars that are collected by different penalties and fines assessed. With those monies, we fund approximately 275 plus victim service organizations throughout Ohio. One of the things that we have emphasized is a need to be certain that we have services available for older victims of crime, with a particular emphasis now on financial exploitation. Is there counseling available? Is there someone to help this person through this event? Because it's the trauma, but also what we know to be so. The research has shown that individuals who are victims of elder abuse, and this includes financial exploitation, have a 3 times higher risk. They're 3 times more likely to die prematurely in comparison to their other cohorts. So we have reason to be concerned. This is more than just dollars and cents. This is real lives. And so we want to have the counselors available. We want to have the services available to those individuals. And so we have certainly been working within our office to be sure that our victim service providers, those that we fund, can provide those services.
Okay. And locally?
Locally, a lot of the health care plans, as well as Medicare and Medicaid, have some counseling services that can help individuals. We also have in some instances, for some of the civil matters, we can get legal aid involved to try to, get some restitution for these individuals. And like she had mentioned earlier, the earlier that it can be reported, the better that we are. It's difficult when you have, hundreds of thousands of dollars that are gone, and it's gone on for months and months and months, right, because it is much harder to recover it once it's been that money has been exploited and been taken. Many times they don't purchase things that have tangible value where someone can go back and try to repossess that
Right.
Property.
They're not putting it in a savings
Right.
account where you can
Exactly.
just go get it.
Exactly.
Right. Mm-hmm.
So the earlier that people can report those things, it just puts us in a lot better position to try to stop it, and try to prosecute the person if possible.
Mm-hmm. What are some of the signs that you would advise our viewers to look for? If you're a neighbor, or if you're a friend, or if you're a church member, what are some things that might trigger a person asking a few more questions, or offering help, or even picking up the phone? I'll let you start.
I think certainly there are going to be some of the more obvious physical things. As I mentioned before, it's really important that we recognize that if there's one type, whether it be the abuse, the neglect, or the exploitation, that we consider another type. And so if you find there are different markings, bruises, different welts, things that just don't have any plausible explanation, or the explanation you're given is inconsistent with the injury that you see, it just doesn't add up. That's a reason for suspicion. Any dramatic weight loss, any change in behavior. I guess I want people to really understand that it's not only just what you see in terms of the physical aspects of the person, but also their behaviors. So you've got a combination of the two, their behavioral cues as well as some of the physical markers.
Okay. You want to add?
Yeah, I definitely agree. Sometimes you can see the physical things, but a lot of times what's more obvious is the change in their personality. Again, a person who's real outgoing and real friendly, being withdrawn and recluse, or when you see them out, they're not even. Maybe they were going out to the mail, and every time you saw them outside, they were waving at you, and all of a sudden they're not doing that. Or somebody that you saw in their yard a lot, all of a sudden you're not seeing them much anymore. Or sometimes, and this almost sounds strange, but sometimes they tell you. Sometimes you have to listen to what people are saying, and they come right out and tell you what is going on. But sometimes we're so busy with all that that we're doing, that we're not listening to what people are they're telling us. You just have to listen.
That's a very important point. Thank you for that. Our time is running very quickly now, so I'm going to ask each of you if there's something you want to leave our viewers with on this very important topic.
Oh, Patrick, did you want to?
I would just say that that there is a lot of momentum in Ohio, and there's a lot of energy and effort to try to do a better job of identifying elder abuse and educating people about elder abuse, and also prosecuting criminals. So we are trying very, very hard and to try to do better in all three regards, to try to identify it, to try to educate people, and to try to stop it, and to prosecute for it. So, and we're not going to stop until we see things that really, our goal is to eradicate elder abuse, that, nobody deserves to be abused, no matter what form it is. And so we want to stop it.
Well, thank you. And the number again to call, in case they didn't get it down earlier?
It's 225-4906.
Thank you. Ursel.
I want to thank you for bringing this important issue to the forefront on your show. I think that the more people we can make aware, the better chance we have to get these reports, and we can become involved quickly. I just say report, report, report. Don't worry about that you got it right. Just report and let us figure it out.
Okay.
Just report and let us figure it out.
So speak out on behalf
Yes.
of the people that you see.
Yes.
Well, thank you very much for joining the program tonight. This has been very good information shared, and important information, and I'm so pleased to see agencies that are taking so much effort in protecting our elders. And thank you to the viewers as well. Good night.